Have you ever heard the phrase scanxiety? Welcome to the Inspired Vitality Show. I'm Catherine, and in this video, I'm going beyond the scans with what I call Cancer-xiety. First, I'm going to share some of my story. Next, I'm going to tell you what the Mayo Clinic says about medical-related anxiety, and then I'll tie it together with trigger events and my strategy to help you persevere through them. It was late February 2015 when I went to an annual checkup and my doctor found a lump in one of my breasts, which led me to a diagnostic mammogram and ultrasound. It was early March by the time I had a biopsy and I was diagnosed with stage 3 breast cancer. I still remember exactly where I was standing the moment I received a call from a nurse telling me that I did in fact have cancer. I remember the fear and I remember the profanity coming out of my mouth. I remember then jumping into function mode as I cleared my schedule for test and doctor appointments and ultimately surgery. All of it taking place in a relatively short amount of time. Not only does my mind usually remember these dates and events, but my body remembers. Each year, late February to early March, my body remembers the trauma. As time has gone on, sometimes my mind has forgotten, but then I notice I'm more tense, distracted, or I have nightmares. I know this reaction resembles PTSD, but I'm not a doctor or a therapist, so I'm not labeling this type of experience as such. Rather, I'm going to stick with the body remembering trauma. When I notice these reactions in myself, I pause, and I realize what time of year it is, and I take steps to help myself move forward. I'm going to share my strategy with you at the end of this video, so stick with me. Too often, cancer patients are told to be brave or be positive throughout their cancer experience. And I'm here to say that not only are your anxious feelings valid, but it is normal. According to the Mayo Clinic, anxiety disorder due to a medical condition includes symptoms of intense anxiety or panic that are directly caused by a physical health problem. This means the worry and fear of cancer patients is a real thing, not an out-of-control, misplaced emotion. Some of the symptoms of anxiety can include feeling nervous, restless, or tense, having an increased heart rate, sweating or trembling, feeling weak or tired, trouble concentrating or thinking about anything other than that present worry, having trouble sleeping, experiencing GI problems, having difficulty controlling that worry, and having the urge to avoid things that trigger that anxiety. While the anxiety disorder due to a medical condition can present with any diagnosis, I'm looking at it from the cancer patient perspective. I believe that cancer-xiety is a concern or worry with daily and significant events related to a cancer diagnosis. Some of these triggers might be, number one, blood work. Because if something shows up in the blood work, it can lead to more tests. Now, speaking of tests, I mentioned the word scanxiety at the beginning of this video because scans, trigger number 2, such as an MRI, can make you anxious before, during, and after. This may be due to not only the anticipation of results, but also being uncomfortable during the test itself. Trigger number 3 is change in oncologists. Although I love my current oncologist, learning my previous one was leaving and partnering with a new doctor was scary. Cancer patients rely on their oncologist to help them make decisions that can impact their mortality, so this relationship is really important. While I'm comfortable in a clinical setting and like talking to my doctor, there's still some nervousness around oncology appointments, and that's trigger number 4. Some of that has to do with receiving test results, but also perhaps trigger number 5, change in treatment. This can be things such as ongoing medications or the frequency of checkups. Now, speaking of medications, all medications come with side effects, and that is trigger number 6. Whether you are in active treatment or post-treatment, most cancer patients manage side effects on a daily or long-term basis. The medications can cause some of the same symptoms as anxiety, such as fatigue and sleep disturbance, which leads to a physical and emotional toll on the patient. Lastly, there are cancer-versaries. That's trigger number 7. These are the big dates, such as your diagnosis date or the surgery date. So why do I think this is so significant for cancer patients? Cancer patients have a heightened awareness that you can easily be that 1 in 8 or whatever statistic is associated with developing a particular cancer. Truth bomb here, some of us were diagnosed without any symptoms. We know that you can be going through life feeling just fine and then be thrust into appointments and treatments and forced to face your mortality. It is a heightened awareness of the unknown and knowing some things are beyond your control. We know what those treatments feel like, so while the cancer-xiety may seem like an out of proportion emotion, it's based on real trauma. That trauma sometimes makes the little voice inside your head tell you that every ache is the cancer coming back, and that is cancer-xiety. I've developed a strategy to help me persevere through the trigger events, and I'm going to share an overview with you now. Are you ready? I'm going to run through this quickly, and then I'm going to tell you how you can receive more in-depth information for free. So first, acknowledge. Acknowledge that pain, that grief, that fear that you're feeling. Identify whatever emotions you're feeling and be honest with yourself about it. Speak kindly to yourself when you are acknowledging. There is nothing wrong with you or your feelings. They are just that, how you feel. The next step is to breathe, to release yourself from the chronic state of stress. Too often we breathe from the throat or the upper chest rather than taking a deep breath. Breathing deeply helps to quiet the overactive nerves and releases tension in your body that you may not even know exists. The next step is to listen to your heart and soul. Once your breathing has centered you, ask yourself some questions such as, what do you need to nourish your heart and soul? Perhaps you need some alone time, or you need to connect with a friend. What is going to bring you a sense of calm? The last step is execute a plan with action. It's a big one, and it comes actually in 2 parts. You need to prepare and execute. Many people go through the first 3 steps or even into preparation, and then they stop. That final step of executing a plan or physically doing the action may be the hardest. Now again, this is just a brief overview. To get more details on this strategy, head to my website, inspiredvitality.life, and download your free ABLE resource guide. It's a tool to help you when you feel stuck. I truly use this strategy myself. At the time of this recording, I have an oncology appointment in 2 days. It will involve blood work and perhaps a change in my ongoing treatment plan. I'm also approaching my cancer-versary, or the date of my diagnosis. I mentioned distraction and nightmares earlier in this video. Well, that was happening for me recently. One day I paused and it hit me that the cancer-versary and the cancer anxiety was showing itself. So I took time to acknowledge my concerns and fears. I made time to ground myself with some deep breathing so that I could listen to my intuition for what I needed. For me, it was to take really good care of my physical health. And I executed it by planning healthy meals and prioritizing sleep this week. Caring for myself in this way has created a sense of calm as I persevere through this time. For any cancer patient, there may still be moments of days or even weeks of cancer-xiety, but when there is a pattern of it interfering with your daily activity or the feelings are difficult to control, then it's time to take action. If you are struggling and your at-home methods aren't helping, please do talk to your doctor or a therapist. Perseverance for me doesn't mean that the cancer-xiety ceases to exist. Rather, it's about getting to a point where I'm not thinking about the cancer every day and I'm able to manage anxious feelings that may arise with a triggering event. What do you think? Do you have cancer-xiety? Leave me a comment and don't forget to head to inspiredvitality.life to download your free copy of my ABLE resource guide. See you in the next video.